Good morning, everyone. Appreciate all those joining us from around the state. I'm giving it just one more minute here on my time to be official, to start at 9 o'clock. Have a quorum. All right, let me call this meeting to order. Appreciate everyone being available today on June 2nd, 2023. I don't think I have any preliminaries, so let's just move right into approval of the April 14th meeting minutes. Dioga sent those out. We had a chance to suggest any corrections. Were any suggested, or were you clear to go? All right. Is there a motion to approve the minutes?
So moved. This is Deanne.
Deanne, thank you. Is there a second?
This is John. I'll second it.
All right, John seconds. All in favor, say aye.
Aye.
Aye. Opposed? All right, they were unanimously approved. We're moving right into a detailed presentation that is important to our work because it goes over the grantees individually, and so I think we're going to be led through that by Owen Cox. So Owen, I'll turn it over to you.
All right, yeah, thank you so much, and thank you to the Children's Cabinet for having me back to discuss this year's accountability process. This presentation is really the work of a lot of folks, including the grantees, so I'm really happy to be here to be able to present a little bit about it. The first thing I want to do, though, is discuss a little bit about the timeline and provide some context for what we're going to see on the slides that we're going to go over here today. So if we could advance forward, I have a slide here on the timeline. And I want to remind the group that the reason the accountability process takes place when it does, and that we present at the June Children's Cabinet meeting, is to be able to better align with the legislative process. So this is a change that happened a while ago, but we did it to really align with the legislative process. Saying that, however, we also should note that we are still in the current fiscal year of 2023. So as we move through the slides, what you will see is the findings on service provision and sort of reach are going to be from fiscal year 2022. So the last completed fiscal year. So you're going to see things like numbers served. Those will be from 2022. And any numbers that you see that are like an increase to 90%, those will all be from fiscal year 2022, because again, they are still completing all of the work that they're doing for fiscal year 2023 right now. And we'll present those findings, some of those findings next year's accountability process, but they will also be included in the annual report. So the 2023 annual report that is presented to the cabinet in December. I should also note that the current fiscal year findings are updated and included. So when you see fiscal year 2022 findings for CIF funds, those are taken directly from the Kansas Governor's budget report for fiscal year 2024. So those are actual numbers. So anything that you see that is a CIF number for 2022 is the actual funding number pulled directly from the budget. I should also note, though, that as you all are aware, the budgeting process for the state fiscal year 2024 just wrapped up. And so it just recently concluded. But then what that means is that state agencies are now starting to prepare their budget projections for fiscal year 2025. And since CIF provides funding to some of those some programs in those state agencies, they need information from CIF as far as budget recommendations to build into their budgets. And that's one of the big reasons that this process takes place now, is to be able to put those budget projections out there for those different state agencies and to get those recommendations on up to the governor to understand how funding might work for fiscal year 2025. That is to say, we cover several years' ground in this. We start with last completed fiscal year for a lot of findings, but we move on to the future fiscal year 2025 when it comes to recommendations for the budget. All right, perfect. And so then moving on for a little bit more context, what you'll see here are some of the basic components of data collection for the accountability process. Every year we request that all programs send us their internal or external program reports from those CIF funded programs. We do this in the hopes of avoiding too many additional reporting requirements. So we're not trying to add a lot of additional reporting requirements, having them create new reports just for us, but we want to leverage the reports that they already create. That might be for federal funding reasons or other state funding reasons, but we want to grab as many of those as we can to get additional information about their programs. Let's see, I think I've already mentioned this, but when you see FY 2022 funding from CIF, those are actual expenditures. Again, that's retrieved from the governor's budget report. So when you see that, you can know that those are from the actual budget report. Any additional funds that we talk about, so additional funds that those programs might have, those are going to be actually self-reported, and that's part of our CIF accountability process survey. We also collect several other things in that survey, so that also gets us a little bit more information on service provision, scope, other details about the program that they want to share with us. But one of the components that we do collect from that are other direct funding resources that those programs receive. And then finally, the last thing that we do is conduct program interviews with each program. And this allows us to discuss additional insights the programs have about serving children and families in Kansas. And we get to have it in their own words. It's a really nice way for us to sort of wrap up the process after collecting all that other detailed data, just to discuss their program with them and hear about it in their own voice. All right. I think we can move forward next to just a placeholder slide here, but what we're going to do is turn our attention to some of that funding information that I just mentioned. So we're going to talk about how funding is distributed from the Children's Initiative Fund and potentially a little bit more about some of the other funding sources as well. So if we want to move forward, what we have here in our first graphic is a depiction of how programs that receive CIF funds or how much they are funded by and which state agency administers those particular programs. So what you have is a breakdown of funding by state agency, and then you can see the funding for each specific one. Again, remember, this is from fiscal year 2022. So again, this is the information from the budget report for CIF. All right, if we want to move forward, another depiction of that same funding is by primary population. So we've broken down how much funds go, what percentage, if you will, of funds go to each specific primary population. We've broken that into a couple categories. I think the main thing to note on this is that a majority of all funds go to that prenatal to age 5 group as far as the primary population served. All right. Next slide that we're going to look at here is this is going to be total program funding. So this includes CIF funds plus some of those other direct funds that were self-reported by those agencies and by those particular programs. What you can see, I think the takeaway from this slide is that Children's Initiative funding actually makes up the second largest category when it comes to funding these programs. And in fact, it's even larger than the state general fund portion that goes to these programs. So large portion of federal funds, but also a significant portion of their funds are actually made up by the Children's Initiative Fund. All right, and finally, this is actually just that same slide, but broken down into a table. As you can see, we have sort of that complete information for the Children's Initiative Fund line, and then some of those other reported pieces when it comes to federal, state general fund, local, and private, which are all sources that are utilized by these programs. All right, I think now, unless anyone wants to talk through that, I think we're able now to turn our attention to the actual programs. And we'll run through each of these, but I want to pause on this slide just for a second and do a little table setting on what we will be seeing in the upcoming slides. Okay, so for each program, we'll have 2 slides, one with a brief program description, and also a little bit of information around service provision as far as numbers served and sort of the counties that are covered by those programs. I'll ask to remind you that it is from fiscal year 2022, that this information that you're seeing on this particular slide. And so the other slide that we will see here in a moment is going to be on program impact. So each program will get 2 slides, one on sort of description and impact, and then one, excuse me, and then one on impact. And Lindsay, if you could go back just to that first slide. I also did want to note on this one that each of these programs also has a program link that is going to be included. The reason I did this is because we're going to move through these programs fairly quickly. But if people want more information about any of these programs, they all have websites that you can go to and just learn more about them. And I really do encourage folks to do that if they are interested. So focusing now on child care assistance, the program itself. This is a program to support families at or below 250% of the poverty line to be able to afford child care by providing the families with subsidies for child care while they work, further their education, or have some sort of emergency need. And this program is really geared to provide support so families can increase their financial stability. So the idea here is to provide these subsidies so that families can be able to leverage that child care to increase financial stability in the job market. If we want to take a look at some of the highlights from the impacts of the child care assistance program. So Lindsay, if you want to advance one slide. Perfect. Thank you so much. What we do see is that 67% of these families receiving subsidy while they're employed saw an increase in earnings. The other thing I want to highlight here is that families that receive the subsidy also report being able to obtain childcare that they would not have been able to do without this assistance or without this subsidy. So it really is important to these families and really does help them retain and work while receiving the subsidy. All right, our next program is the Early Childhood Block Grant, or ECBG for short. You'll be learning a lot more about this program during next cabinet meeting, so August cabinet meeting. But what I really wanted to mention here is that this program really does focus on providing services to at-risk children in the early childhood years. Services include early childhood care and education, social emotional consultations, home visiting, literacy, excuse me, if I can read my own writing there, literacy activities, and parent education programs. So covers a lot of different services to children and families in Kansas. Some of the impacts, just to name a few from last year of the Early Childhood Block Grant, are that 67% of ECBG classrooms were scored as high quality, which is great. And the pre-K classrooms saw increased percentages of children scoring as on track for language comprehension, phonemic awareness, and numeracy skills during the school year. All right, moving forward to family preservation, our next CIF funded program. This is a program that offers 2 tiers of services for families, and all those services are geared toward reducing the risk of children being placed in foster care. So family preservation works with families to determine what scope of services will best fit that family's needs and gears the services toward that family. Some of the reported impacts on family preservation included families seeing an increased stability because of the supports they receive. So families report that these services really do increase family stability. And as you can see from some of the other numbers on this slide, both Tier 1 and Tier 2 services do see a high percentage of children avoiding foster care placements during services.
Oh, and this is Melissa. I would just note that this is prescriptive. This is DCF working to place families into family preservation services. So these percentages are remarkable given that these are families that are at risk of having their children removed for a variety of factors. So this is a highly successful approach to keeping children safe and helping provide interventions for families. So just wanted to make sure you understood the impact of those percentages.
Yeah, absolutely. So this is families that are involved with DCF already. So it's as you said, should be noted and remarked upon how well they're doing. All right. The next program is the Kansas Early Childhood Developmental Services. And so this is a newly rebranded program. It's a program that's been with us, but it's newly rebranded. You might remember it previously as Tiny K. The rebrand took place after hearing from families and is meant to align the program's name more closely with the services that the program provides. And those are early intervention services for children in Kansas, birth to age 3, who have a disability or a developmental delay. Right. Some of the impacts include that 99% of the children showing an increased use of knowledge and skill while in the program. And 96% of the families report that the program has aided in their child's learning and development. So I think those are good highlights for that particular program as well in the work that it's doing. Okay, moving along to the Kansas preschool pilot. This program funds school districts and community partners to set up high quality preschool programs for children 3 to 5 years of age. And those programs, importantly, are set up using evidence-based curriculum. Some of the impacts seen for preschoolers enrolled in these programs include that 94% of the children showed improvement in literacy and/or mathematics from the program's beginning to the program's end. They have also seen several programs moving to full 5-day services to hopefully better serve the community needs. So that was exciting news as well. Our next program that receives CIF funding is the Kids Network. And this program offers support services to individuals who have been impacted by the tragedy of infant death. It also provides community education, professional training, and research that's all meant to strengthen statewide infrastructure around infant death prevention. Some of the impacts include those 120 safe sleep events held across 27 counties that you see there. In those, participants have shown an increased commitment to safe sleep and tobacco cessation best practices. They've also seen gains in the number of hospitals and clinics gaining safe sleep certification in particular, and that has increased the number of infants being served by certified providers across Kansas. Okay. Moving right along to maternal child health home visiting. This is a strengths-based home visiting model that is open to any Kansas family with or expecting an infant in its service area. Families get to receive individualized care before, during, and after pregnancy. One thing I did want to note on this particular program is that MCH Home Visiting did receive additional funds from CIF for fiscal year 2023. So we're really excited to learn more about those impacts of those funds during next year's accountability process and also potentially during the 2022-23 annual report. So excited to hear a little bit more about the impacts of those additional funds. All right, some of the impacts that we have seen and that we talked about when we interviewed MCH Home Visiting is that they've included new home visiting providers, and they've also seen expanded capacity for already established providers. So excited to see that they are able to expand their capacity and scope a little bit. MCH also had programs report a reduction in the likelihood of child maltreatment, and they saw an increase in positive parenting practices while individuals and families were receiving services from MCH Home Visiting. Right. Our next program to update on is another home visiting, and that program, and that is Parents as Teachers. Parents as Teachers is an evidence-based model. It's designed to give parents the tools needed to support healthy child development. One of the key components or important components certainly is early childhood screening, and the program uses that as a way to help identify areas of concern, also to help then implement interventions with the family, or for those families or additional resources as needed for those concerns. Some of the impacts of parents as teachers include completing over 55,000 personal visits, and that has helped lead to the identification of nearly 2,300 developmental delays or concerns, which can then be, either assessed and worked on during home visits or as referred out to community resources as needed. Another interesting thing is that parents as teachers also saw a 90% retention rate for local families. So folks who start services often stick around when it comes to this particular home visiting model and program. All right. Moving forward to tobacco prevention program. This is the final 2022 funded program we're going to discuss before moving into a couple other things. But I wanted to highlight this one as well and talk about the fact that the tobacco prevention program, the Tobacco Use Prevention Program is a program that uses evidence-based strategies as well as community partnerships to try and increase the public's awareness of the negative health impacts of tobacco use. This program also works at the community level to promote policy change around the use of tobacco products. All right. And speaking of some of those policy promotions, some of the impacts include 19 new local tobacco control policies implemented. And they also talked about the development of a new online healthcare training module, healthcare provider training module to provide additional education and resources concerning harms associated with tobacco use. And I will say that they shared that they've seen a large amount of folks, healthcare providers, taking advantage of that training. So happy to hear a little bit more about that again as we move to the next fiscal year and see how many folks have been able to use that and what that impact might be. Okay, so I did want to touch just briefly.
Owen,
Oh,
actually,
yes.
can I ask you a question? It's John
Yeah.
Wilson. Can you go back to the previous slide?
Yes.
I was noticing on the fourth bullet about the decrease in high school students who have smoked cigarettes. Is the framing of that bullet mapped back to the question about specifically cigarette smoke, or does it include vaping? Do you know that answer?
So I believe I believe this one is specifically designed for cigarette smoking. I would have to go back to their program reports to understand if they pull vaping out specifically as well. I'm guessing that that is true, but I don't have that in front of me.
Okay, no stress. Thanks.
And I would actually, I could pause on this slide as well, because they did share a little bit of information about the recent lawsuit that was settled around vaping and how states are receiving some funds from the tobacco manufacturers for that. And they're interested to hopefully be able to leverage some of that in the programming that they have as well. All right. So next, as I said, I want to talk a little bit or draw some attention to a couple of the programs that are new for CIF for this 2023 fiscal year. And so we did actually meet with these to discuss these programs, but again, they don't necessarily have complete data because they are still in this current fiscal year. But the first one I will highlight is the Imagination Library. Excuse me. I don't want to spend too much time on this program because I know that further on in the agenda, there will be more complete updates on this program, and I don't want to steal anybody's excitement or thunder. But I did want to just point out that, again, as you probably all know, that this program's focus is to provide free books to children from birth to their fifth birthday. And I was going to say that, as you can see from the map, we have a lot of coverage in Kansas, or at least partial coverage for all of these counties. I should take a moment to note that this map is actually from May 31st, and that new counties are regularly coming on to the program. So I'll leave it there. And then if we want to move forward, we can get to the early childhood infrastructure. So this is a new program, or I guess line item, if you will, from the Children's Initiative Fund. And this is for early childhood infrastructure, and it's to support the long-term vision of the All In for Kansas Kids strategic plan. And so you can see a couple of the programs that either are currently funded or are projected to be funded with this source of income. And so that's what you see, 1-800-CHILDREN. We've got some support for the early childhood integrated data system, as well as some one-time expenses for program support material. And then it was leveraged for additional funds for Dolly Parton's Imagination Library, or the Imagination Library of Kansas, as it was needed.
Just that's a one-time FY23 situation because we had $500,000 in the Dolly Parton Imagination Library line item, and we have enough kids enrolled that we've exceeded that number in the final 2 months of the year. So the infrastructure funding is helping us bridge the gap until the increase that we receive in the line item starting July 1. So, and we've rearranged some of the cabinet administration to free, which was coming out of early childhood block grant funding. We, over the last couple of years, have been internally restructuring so that we can drive as much of those dollars into the grants that we seek to give as feasible. So we're in a really healthy place where that is all concerned.
Thanks, Melissa. I think that's a great example of the impact of the efforts around the Imagination Library, is that, in fact, we had such great sort of buy-in early on that we needed to leverage some additional funds to be able to support the program. So I think that's awesome. All right. I think now is actually, I just want to pause and take a moment and then talk about some of the key key takeaways that we found from all of these different pieces of information that we gathered from all of the programs. And that is really that these programs continue to support critical services and supports for the healthy development of Kansas children and families. We can see this not only from the evaluations that each program provides to us and the work that they do, but also from the words and the actions of the families they support. So they are often bringing us information not only about their program when it comes to like the reporting, but they can bring us back information from the families their programs support and serve. And those just really speak again to the critical supports that are provided to those families. I will say, and I think that this is probably not coming as a surprise, nearly every single one of them still mentioned that workforce continues to be a difficulty in the early childhood care and education system, and that is at multiple levels. So it goes down from staff members at the like direct service provision, all the way up to state agencies needing to fill positions for these particular pieces. So I think that really continuing to understand supports for the workforce are going to be important to really help move the work that these important programs do forward. And then also, as we have seen, and from these programs working directly with families, CIF programs served families continue to talk about resiliency, but they also still report the need for to continue to get supports for their basic needs. A lot of families are still struggling throughout Kansas to meet basic needs. And so we hear that as far as the program reports and information that we gather from the CIF programs. And then one last one that I wanted to mention as far as one of our key takeaways, and this is that programs have really expressed an emerging need for additional mental and behavioral health resources for children, families, and staff. What they're sort of imparting is that they're really seeing additional behavioral concerns from children that they may not have had seen previously. And so they're interested in ways to provide supports around that, but also to provide supports to staff to understand how to best support those families. All right, and with that, I think I'm going to pause and open it up for any questions if there are from the group.
Sure, let's go ahead and see if there are any questions.
This is Monica Kim.
Sure.
No questions, but once again, stellar job. Stellar. And I'm going to say it again, broken record, there is no other funding stream that can produce this kind of accountability information at this level. So thanks to everybody every one of those bullets took a whole lot of work. So excellent. And I'm going to put a big asterisk by the mental health component. And I'd like to say my perception is that has to do a lot with availability of appropriate providers at the local level, which, we've heard it over and over again, but we cannot forget that just because you have a degree to be able to provide behavioral health services does not mean that you have the ability to be helpful to folks under the age of 5 and their families. So probably an even more intense need. But thanks to everybody who did the work.
Anything else? Thanks, Monica.
Yeah, this is John Wilson. I'm keying in on the third bullet and reminded of recommendations we've made in the past as a cabinet about encouraging the governor and the legislature to support policies that help families meet their basic needs. Because if we don't, I think at worst make it harder to continue to achieve these good results from these well-evaluated programs, but to go as far as just undercutting our investments in these programs and negating their positive benefits.
John, to that end, we did, in your packets, the recommendation prep materials solely focus on the budget. Are you interested in renewing the recommendation?
I don't know that I've thought that far in advance. I just would highlight it. I'm highlighting it here on this. Maybe I can noodle on it. How about that?
And we've got August, October, and December to continue to hone cabinet recommendations that relate to everything else besides the budget itself. So why don't we stay focused on the slate that we have in front of us today, and then cabinet members, I'm not just speaking to John, but to the entire cabinet, as we approach the rest of the meetings this year, it's always in order to bring forward a recommendation. So just
Thanks.
let
Low
us
pressure
know.
situation then right now. Thank you.
Not at all.
This is probably an unfair question, but are any of these programs not maxed out with federal funds because of the state match is not sufficient? And that may not be, your funding may not be what you pay attention to, but.
So that, I don't want to say for sure because I don't have that information in front of me, but there may be some state agency leads on the call that could assist with that.
Yeah.
And I don't see DCF. The ones I'm thinking of would be the child care subsidy program and the family preservation. I don't know for sure. We can certainly ask them to provide information, but I believe that if there were additional dollars available, that those federal, the family preservation may be a competitive grant process, but I know it's tied to a formula based on state effort. So I think there's potential that we could draw down more child care subsidy funding than we are.
Well, it seems like if they're working and they seem to remain headline kinds of problems in the state of Kansas, that, maybe that needs to be pointed out. I don't know if that's our job or if it's the agency's job or if it helps for us to point that out. But
John, were you?
Yeah, this is John. I'm 99.9% sure we put the full match towards the child care subsidy to draw down the
In
full
the
amount
FY24 budget?
Yeah.
Okay. Yeah,
Okay.
that's right. To give credit to the legislature, I believe there was enhanced funding provided. Thank you for that reminder. So it is
Okay.
not solely our line item that is funding that.
Okay, thank you. Any other questions? Okay, Ellen, I think you can continue.
You know what? We've reached the end of my segment, but this also provides me the opportunity to thank my team here at CPPR for all the work that they helped me do to get to this moment, but to also give a very large thank you to all of the CIF funded programs who worked with me over the course of months to bring this to you. So I just want to make sure that I give them a shout out as well. So I really appreciate you all inviting me to talk a little bit about them.
All right, well, thanks for the good presentation today. We appreciate it.
Thank you.
Now we'll turn to budget recommendations from Melissa.
Yep, thank you very much. And I want to echo the thanks to you and the team, because I know this is an ongoing year-round effort that you engage in as we work with programs and gather the data. So we, as always, appreciate everything that the team at KU CPPR does, and we will be able to feature the work of Wichita State at our August meeting with regard to the Common Measures Initiative for ECBG. But anyway, thank you. So if we could shift attention to the budget recommendation. We are, again, as Owen mentioned, we're talking about the state fiscal year 2025 budget cycle, which is a year away. As he mentioned, we have to do our work now because over the next couple months, the state agencies are building their own budgets. Our CIF funding slates feeds into the budgets that all three, KDHE, DCF, and KSDE, submit to Division of Budget. Those budgets are due in mid-September, usually around September 15th. And with regard to the State Department of Education, it is a budget action that is taken by the State Board of Education. They have a budget cycle of their own, and they need that education half of the CIF budget has to be available to be incorporated into their actions. And then KDHE and DCF independently receive our recommendations and factor them into their budgeting process as well. So it's always, we began working on this presentation before the legislature adjourned for the year. So it's always a trick of mental gymnastics to be juggling the various budget cycles and thinking ahead. But we do, what we want to present today is a recommendation. If we could advance to the next slide so we could be looking at the table with the numbers, I think it'll help. We really are looking at minimum, this recommendation is carrying the current FY24 numbers into the FY25 budget cycle at a flat rate. And I would note that on the left hand, the program column, we are using the titles of the line items as they exist in the state budget, the governor's budget recommendations. So that's where you'll see it's listed as parent education, but the legislative intent has long ago been clarified that we mean parents as teachers. So these are the formal titles to the programs that you just saw in Owen's presentation. We also, I don't have it available to circulate as yet, but after next week, we will have updated tables that show the current status for the Kansas Endowment for Youth and the official table for the Children's Initiative Fund. What is still pending is approval of the state employee salary plan. That is impacted by legislative direction to take a look at market rates for certain positions. That will all get certified next week. So we didn't want to put those numbers out. And we don't make a recommendation as part of our slate. That is action that occurs between the governor and the state legislature. So we removed the pay plan from this because it is not locked down, and Division of Budget is not ready to post the key fund table summary, but they did give me preliminary. And so, with mindful that this is their draft version, we always plug in an estimated dollar amount for the revenue coming into the key fund, and it's always very deliberately a number that they feel is lower than the anticipated revenues are expected to be. And so the number lately that they've been plugging in the last several years is $50 million in revenue. In April, when the payment was announced, it was 55.8 million, and specifically 55,894,946. And so we exceeded estimates, but there's always that note of caution that this is entirely dependent on the sale of tobacco products. There is a federal initiative known as Tobacco 21 that passed. Kansas passed the matching legislation that was necessary. So we have if I'm not mistaken, it passed all of the hurdles and became law. So Tobacco 21, that means you have to be 21 years of age to purchase tobacco products. You saw that we fund efforts to decrease the use of tobacco products. All of that is a good thing, right? That is what we want. That is healthier for individuals, and it's a good thing. But the flip side is it does have an impact on our revenue source. So for that reason, we had higher than anticipated revenues the prior year. I think we were at 59 million, and it dropped a little bit in the wake of the federal legislation. So we're taking a cautious approach. I'll be talking more in my director's update about the work of the governor's early childhood transition task force. But that is another area where there are a lot of open questions about whether there will be recommendations to reorganize some of the way that that early childhood programs are administered and where they are housed. And so we took a very conservative approach with the FY25 budget recommendation. I will say that if we are heading into the August or the October meetings with a need, a desire from this board to change up the recommendation at all, we can make an adjustment to it, which I join KSDE on their call with Division of Budget for the budget appeals process, which usually takes place in November. So there is opportunity to come back and make an appeal to amend ahead of the governor's budget being completed. So this is not cast in stone. I know last year we had talked about increasing line item transfer amounts. We've not had any program level requests for increases. We were able to satisfy the early childhood block grant, the overall application process. I think we felt like we could satisfy all of the eligible requests. And so we're gonna recommend holding the line, and you can see that on the bottom line. The ending balance of the key fund that is projected in the final approved budget draft is it's 28.1 million. So we're in reasonable shape, and we could not cover the entirety of this budget if there were a collapse of things. But it is, I think anytime we're above 20 million feels like we have some breathing room. So I'll leave that here and open this up for cabinet discussion.
Yeah,
Okay. Monica?
this is Monica. Quick question. I know I should know the answer to this, but under infant toddler programs, the 5.8 million, does this, and I'm apologizing, I really should know this. Does this represent the entire state contribution to infant toddler programs from,
Owen,
or
can
are there other
we,
KDHE funds?
Owen or Lindsay, I guess, is in control of the slides. If we could toggle back, that information should be listed right. Let me.
That's going to be the KECDS. So that's the renamed Tiny K program.
So there is 4 million from state general fund, and there is another 1.1 local, and then the 894,000 from private.
And I should, sorry to jump in, Melissa. I should note again, this is from reporting from fiscal year 2022. So things can have changed since then.
Thanks. I appreciate seeing that. I'd like to talk about the private piece. So what I'm thinking there is as we think about this funding in the context of the governor's task force, I think this kind of information will be really helpful to that group as,
Yep.
you know, as they look at this whole big picture thing. And again, I just want to draw back to the importance of the accountability process. I mean, having this kind of information available for that bigger function is so incredibly helpful. And thanks for the clarification on that line item specifically.
Absolutely. We can, it's hard. We won't have FY23 numbers until later in the summer. There's a process to reconcile the books at the close of the fiscal year, which is, as Owen points out, why we end up having to use FY 23, 22, go back to that prior program year. But we can dig into some of what's anticipated or estimated.
It's a great
And-
start. I mean, it
Yeah.
really is. It's
Yeah.
really fantastic.
The other thing, Monica, to your point, we as a cabinet, I have provided, we had engaged in a fiscal mapping process in 2019. So we've conveyed those materials to the Hunt Institute, that knowing that the numbers themselves have changed certainly, but the mapping of where resources are, that this information stems from a lot of background work, and we absolutely are helping equip the folks running the task force with this kind of material as baseline information.
Any other thoughts, questions? Well, this is a recommendation that takes formal action of the cabinet. So I'll continue to say if there are any questions, but if there aren't, we could entertain a motion.
Ms. Monica, I'll move to approve.
Okay,
This is Delise, I'll second.
all right, it's been moved and seconded to approve this budget recommendation. We will take a roll call vote on this. John Wilson,
Aye.
Tyler Smith,
Aye.
Terry Rice,
I don't believe she's on.
Monica Mernon,
Aye.
Delise Hofen,
Aye.
Deanne Owen Graham,
Aye.
Leetta Felter. Guess she's not on.
She's not on.
Senator Erickson
Aye.
and myself, I. So that carries. Thank you all. We, as I understand it, that's sort of subject to open. There could be amendments brought if necessary between now and October or December, but we have a recommendation that can be moving in the processes that need to move forward. So.
Yep. So what Lindsay's put up for you are a couple of slides. This is the bar graph you saw up front was the status as of FY22. This is what that graph will look like for FY25 based on the recommendation that you just made. So, and then I think we also have the other, the pie chart. So just so that we can continue to keep you aware of how the funds that we manage are being utilized. You'll see these again in the annual report, obviously, but I want to thank you for the approval on that, and we will keep you updated as any of this evolves over the course of the coming months.
Okay, thank you. Well, our next item for consideration is membership on the Early Childhood Advisory Council. And Melissa,
So-
you're going to lead us through that or somebody else?
I can do that, Kim. Thank you. So as a reminder, the governor issued executive order 2002. So it was the second executive order of the calendar year 2020. And it brings the state into compliance with the federal Head Start legislation, which requires every state to establish a state advisory council on early childhood care and education, so the executive order designated the Children's Cabinet to serve in that role. So we periodically will bring you recommendations to consider in your role as the state advisory council, but the federal requirements have some very specific positions representing certain areas of early childhood care and education as a requirement, and we do not possess that expertise and those positions within the membership of the Children's Cabinet. So the executive order directed us to set up the Early Childhood Recommendations Panel to serve as a standing committee to provide guidance to us in our role as the advisory council. We've established that several years ago, and we outlined one-year terms of membership, and we aligned it to begin and end on the state fiscal year cycle. So every June, we revisit the membership of the panel, make sure that we maintain compliance with the required seats, and open it up to providers and practitioners and parents and all of the folks with expertise in the early childhood space. So the June meeting is when we seat we make those appointments for the coming year, and they will have their first meeting as a group in July. So we sent you the slate of recommended names. What I want to note that in years past, we've really been the first time or two we accepted everyone who applied because we were getting it established. We were in the middle of the pandemic. We thought if people are interested, particularly in that first year, we welcomed everybody. That has kept membership at around 40 people. This year we had we had 85 applications, which is a record, and we really felt like getting much bigger than we are would become difficult, like make it more difficult to manage. And so the chair, Cornelia Stevens, who represents, she's the executive director at Top Early Learning Centers in Sedgwick County. Cornelia is serving as chair, so we worked with her to review the slate, and we certainly gave preference to returning folks that were willing to serve again. So we have 21 members of the slate are returning, and then we have 24 new members. So we settled on 45 members, and appreciate everybody who showed interest in applying. One way that we helped winnow the field was to work with organizations that had multiple applicants to ensure that the person that we appoint best reflects the organization as a whole and is positioned to carry the work of the panel back to work internally, so that we, rather than having multiple members of variety of places, we wanted more diversity across the slate of programs, and we wanted to make sure we had geographic representation from all quadrants of the state, and make sure that we had a variety of roles, so that we had the most robust recommendations panel that we could. We also have the panel divided into working groups, and those working groups know that if they need or want input from outside that small group, that they are welcome to invite voices to the table in their planning and their work that are not formally members of the panel. So those folks that expressed interest, we know who you are, and we absolutely will. There will be ways that we call on you for input over the course of the coming year. And again, we thank everybody who participated. The list is divided into the categories that are required by the Head Start legislation. Where you see representatives of state agencies, those are folks who represent specific programs that we are obligated to include at the table. So that is the one place where you'll see several members from the same agency that is specifically driven by the role that they play within their agencies. The packet that we sent gives a little bit of, at least the title of their role. There's not a lot of room on the slides, so we opted to go with the organization they represent, but the position they inhabit is better defined in the prep packet, which as always, we will post online for everyone to see that is interested. So this is the slate. It takes 2 slides, so we're toggling back and forth, but this is our slate. We feel really good about the range of expertise at the table, and I would open it up for any potential discussion that you as the Children's Cabinet has, but this would be our proposed slate for appointment to the recommendations panel.
Okay, are there any questions or comments? I guess I was impressed that there are, that the impression of this group must be strong enough that 85 people wanted to be part of it.
That was our takeaway too. We were pleased that it has taken root, and it is they're doing good work. And I want to also let you know that it doesn't always require bringing a recommendation to us as the advisory council for change to happen. So what we've seen, and it delights me, is that with this kind of team effort, there's often problem solving that happens without ever having to go through the formal steps of bringing a recommendation and sharing that out. That there's been really good responsiveness within this range of work. The scope of work that they engage in has proven to be really helpful to the early childhood system writ large.
Any questions or concerns about this? This also is a action item for a formal vote. So let me be sure if there are any questions.
Hi, good morning. This is Tyler. Just a
Yes.
general question also is, I do like to see that there has been so much interest from people in wanting to participate. What are some of the components or criteria that you all use to determine who will be selected? Because it sounds like working hard to diversify the people that are participating.
Yeah, we, as I said, we take a look at a variety of factors, and it starts with the federal requirements to be sure we have the right the right expertise at the table. It includes geographic representation to make sure that we've got voices from the urban core to the frontier rural. I mean, we are trying to make sure that we are getting regional geographic representation as well. We look at expertise and make sure that we have like where childcare providers are concerned, we have a variety of types of licensed childcare. So we were mindful that we wanted family childcare providers to be at the table alongside their peers who run center-based programs. So there's a lot of work done to ensure that we don't lean too heavily on one sector or another. One of the places we trimmed back where we are required to have school districts at the table, but that's where we had a high number of applicants, and we didn't want to weight the membership so heavily that created a disproportionate view. And so there's a lot of work to balance across those issues.
Thank you so much for sharing that. I appreciate it.
Yep.
Anything else? Is there a motion to approve this list?
This is Delise, so moved.
Thanks, Delise. Second,
Second, this is Deanne.
Deanne, seconds. Any further discussion or questions? If not, let me call roll. John Wilson,
Aye.
Tyler Smith,
Aye.
Terry is an on, Monica Mernon,
Aye.
Delise,
Aye.
Deanne,
Aye.
Leetta, Senator Erickson,
Aye.
and myself, aye. All right. Appreciate that. That seems like that's been a good good movement forward, to not only to get in compliance with the law, but it seems like they're doing some creative work and really creating a kind of a good forum for a broad base to the child care community. So that's looks good to me. Agency updates. You got a cheat sheet for me? Oh, good, you do. Amy, want to bring us up to date on ourselves?
Sure. Good morning. Amy Meek with the Kansas Children's Cabinet and Trust Fund. Since our last meeting, I am pleased to announce we have hired our early childhood program coordinator, who's going to be taking the ECBG and the CBCAP program lead and working with the grantees. So Christy Wyckoff has joined us. It was a month yesterday. She started May 1st. So she has been a great addition. She comes to us from a school finance background and lots of great skills of working with programs. And this has been a really busy time, but also a good time for her to join, because we are onboarding or getting our new ECBG grantees ready to start their new grants in July. And so making those connections and making sure that they're understanding the data requirements and getting training set up for them as needed. So we have 8 of those new grantees. And so she's been meeting with them and making sure that they're connected to her and Wichita State and are ready to start their new grant. And then our current grantees are wrapping up their data entry. We ask them always to have their all their data for the ECBG grants into our DAISY system by the end of May. And so then we can pull that data, and Lynn and her team gets very busy working on that evaluation so they can present to you in August. So our grantees, I want to give a shout out to them. They work very hard to collect the data and then also make sure that it gets entered and in DAISY, and they do a great job with that. For our community-based child abuse prevention program, we had an in-person meeting last week in Baltimore, which was our first meeting since March of 2020, mid-March, and we all know what happened then. And so we haven't had an in-person meeting, so it was a really great time to connect with the federal project officers and also other state programs, and hear about work that's going on in other CBCAP with other CBCAP grantees or state leads. Christy was able to attend that, which was also really great timing so that she could get an introduction to CBCAP and to hear about some of the other programs. We also submitted our application for the next funding cycle. It was due today, I believe, but we submitted a couple weeks ago. So we'll just be awaiting our notice from the feds for that award. And that usually doesn't come until September or so. Our PDG work is still underway as far as the renewal grant. We did get a no cost extension of a year. And so our normal grant period ended April 29th, but we have a 1 year to continue some activities. And that the work, of course, of the workforce registry is underway and the build out of that. And it's pretty exciting. In my new role, I'm a little bit more connected to that. And so I'm looking forward to in the coming months being able to roll that out and give some demos of that as well. The planning grant, which started December 30th, the major activity that is happening right now with that is the needs assessment. So we have KU working hard on, they've collected all the data sources for that, and now working on pulling that all together. So lots of stuff. This is a busy time as we're getting ready to transition out of one state fiscal year into another, but yeah, a lot of exciting things going on.
All right. Any questions? All right. If not, thanks, Amy. Amanda, okay, KSDE.
Good morning, everybody. I have been sharing with you for the past several months that our State Board of Education has been engaged in a series of retreats as they set their goals for the next several years, with several new members joining the board, and in May, they approved 4 board goals that will drive their work towards our Kansas Can vision between now and December of 2024. Those goals focus on enhancing the number and quality of educators in each district, increasing students' opportunities for post-secondary success, making sure that we are enhancing engagement and partnership with families, communities, business, and policy stakeholders, and providing a safe and secure environment in each school. The state board next month will hear and dig more deeply into that question of how we can support students as they prepare for post-secondary success. And I'm really excited that we're going to be increasing our focus and sharing our information around how districts can best support students in what we're calling the 4 fundamental elements of effective education. And those are things that would not be of surprise to anybody here. In fact, tie really nicely back to what we were talking about during the accountability report. We'll be focusing on structured literacy, the use of assessments and data to be able to support instruction, alignment with standards, and high quality instruction in classrooms and other environments. So we're really looking forward to the work there as we continue to move forward and to focus our work as an agency. The second piece that I wanted to share, other action that the State Board of Education took at their May meeting, they approved preschool aged risk programs for the coming year, which means that districts are able to receive funding through the school finance formula for students who meet certain criteria. The State Board also approved grants for the Kansas Preschool Pilot and the Kansas Parents as Teachers grant program. So 2 of the Children's Initiatives funded services that we just discussed. So those grants are for the year that begins July 1. And then the last piece that I wanted to share, if you haven't already, I hope that you help spread the word that Sunflower Summer has launched again for the coming year. So each Kansas child pre-K through 18 years of age, as well as students in 18 to 21-year-old programs and 2 adults have the opportunity to download the Sunflower Summer app and to receive admission free of charge to over 100 Kansas attractions. In the very first week of this, more than 14,000 Kansans took part in this initiative, and we really hope that people will help spread the word and share that this is a great opportunity to make sure that the summer can be a really engaging time of learning. So you can go to sunflowersummer.org to learn more about that, and I hope that you will spread the news in your communities. There's certainly been information on the Children's Cabinet social media, on the State Department of Education social media, and I've loved getting to see posts from families who are taking advantage of that opportunity. So I'm glad to answer any questions.
Amanda, I will just note that on my commute every morning from Kansas City to Topeka on I-70, the city of Wichita has a billboard now that is touting visiting Wichita and enjoying free attractions with your family. And in one section of the billboard is a screenshot of the app itself. So it is very clear they mean Sunflower Summer. I think they, as a group, came up and discussed the benefit that they've seen in the city over the summer months the last couple of years, the increase in tourism. And we know that in the app, attractions get to see the zip codes that people come from, and they I think pretty uniformly are excited about the benefit to their just the foot traffic through their attractions, and then restaurants and hotels and gas stations and all the rest along the way benefit from the increased economic activity.
Yeah, seems like really a great thing that's taken off. That's wonderful. I will let my grandchildren know.
Yep, for sure.
Okay.
You should download the app so you can take them, Kim.
Well, I know. I'll have to look at that. Seriously.
Yep.
Anything else for Amanda? Derek from KDHE.
All right. Good Friday morning, everybody. Thanks for having me once again. Derek Flerlog, one of the co-directors for the Bureau of Family Health here at KDHE. I do want to point out that my colleague, the other half, the better half of the Bureau, Dr. Jessie Piper, she's on with me as well. So a couple updates for everybody. I guess I'll start by saying just a reminder that Jessie and I started late February, early March. So we're still grasping the system, kind of right alongside the task force there, and looking closely at coordination, internal coordination, and then external coordination as well with the other agencies and partners that we work closely with. So I think we're grasping things a little bit better each and every day. We both feel a little bit more comfortable, but still a ways to go on that. So, and for anybody that we haven't met yet, feel free to reach out. Would love to exchange info and make connections. So I think besides, kind of the fun end of year, fiscal year stuff, which is a good time to start, we've got our aid to local funding determinations that have been finalized and inputted. So we have that going on. It's really specific to childcare licensing, which sits on my side of the Bureau, as we say. So sending the funds out to local health departments that we contract with for the purpose of surveying and things like that for our childcare providers. And then Jessie has some aid to local stuff on her really community partnerships section. So it's been a learning process for us, and it's been fun though. Something I do want to mention is in WIC. So WIC also sits on my side. Dave Thomason, who's been the state WIC director for 25 years, started in 98. He is retiring at the end of this month. So I just wanted to give a shout out to Dave for 2+ decades of work in WIC, and we're working hard to interview applicants, get an interim director in place, make sure we pass on all of the knowledge, at least as much as we can from Dave. So we're excited about the future in WIC. We did receive some additional funding specific to modernization from the USDA, and so that can be used for a variety of things. But we're looking at we've recently engaged in modernizing, like we have some phone apps that we do, and of course we're part of a consortium, a group of states, one of which is Hawaii, by the way. I always think that's cool. So we're in a group with Hawaii, and we all kind of share some modernization techniques and technological platforms and things like that. So big shout out to Dave, and thank him for all the work he's done in that time frame. And I'm lucky to just have been around him for a little short amount of time here. Moving on to childcare licensing. So we have a media campaign that is actually what's the 2nd of June now. So we have a couple of those assets, as we call them, that are rolling out. The tagline is Childcare Matters. So hopefully you all will see that in one way or another. It's going to be via radio advertisements, some television advertisements, social media, of course, across a bunch of different social media platforms, Facebook, Instagram, some Snapchat advertising and things like that. So super excited for that. And as we really get into next week and into the following week, hopefully you should see more and more of those pop up. But we're really, really excited about that. And it's been a positive experience. And so again, kind of promoting the importance of providers and really kind of prodding those that are interested but need that little extra push to become a provider, and just highlighting what a noble career that is. So alongside that, we've also done a few updates to our childcare licensing webpage, KDHE's specific childcare licensing webpage. And we now have a new tab called How to Become a Licensed Provider. So we're really trying to streamline the process for folks to see what that process looks like, I guess. So it's laid out in steps 1 through 5, I believe. And then we have a resources tab. And we've worked really hard alongside DCF to make sure that we're partnering and getting information from each other so that it can be disseminated out to those that need it. So we'll be directing folks to that too. We have another quarterly education series. We started this in late April, quarterly education series where childcare licensing providers can attend. It's a virtual Zoom presentation. So we had the first one back in April, and it was, we had 200 plus attendees, which we were really happy with. We got that one going kind of quickly, and sent out via surveyors to providers and social media for folks to register on that one. We have another one upcoming in July. And so we've been able to start sending out that approved flyer yesterday. And then you'll be seeing that posted to social media here in the coming week or two. Same thing, the title of this one is the on-site survey process. And again, that can be counted as part of their a provider's annual in-service requirement. So we've gotten great feedback on that, I'll say. So and it's been good to get to meet all of them and work closely with them on that, and just kind of craft that partnership even more. I think that's been something that our program's been trying to do even before I started, is just make those connections and grow closer to them, the providers and the surveyors, and our partners as well, everybody on this call, to just really express what the childcare system is, the early childcare system. So next up, I think, is probably what everybody's wanting to know, which is our regulation review. So, we're currently working collaboratively with some dedicated consultants. So we have an ongoing formal regulatory review and the promulgation process. And to this point, we've identified a number of regulations for revision. So the identification, of those regulations, that's based on feedback from stakeholders. It's from partners. We have some federal requirements that we have to get up to speed on that's tied to funding, and then some of our own just internal expertise and review. And we've been able to identify a number of regulations for potential revision and drafting of some updated language. So we have prioritized this review, and we'll begin gathering external stakeholder feedback on those revisions really soon. So we're super excited about that. We have the team that I kind of just discussed. At this point, we're meeting about 10 to 15 hours a week, and those are formal meetings, dedicated formal meetings. That does not include the work that's done outside of that. We often will assign homework for folks to evaluate the regulations themselves, feedback, drafts, and things like that. So excited for where that's going. And we're excited to build that partnership out, begin meeting with those external stakeholders, providers, partners, and really get going on that. So I think with that, that's all I have for you. And thanks for having me. I can take some questions.
Okay, let's see if there are any, Derek.
I would just note for the cabinet that preschool development grant, planning grant funds are being utilized to underwrite the outside consultants that are helping assist KDHE staff. Staff have a full menu of responsibilities, so the extra consulting help is helping give some dedicated lift and energy to the task at hand. So
Absolutely.
We are pleased to be supporting the team at KDHE with this.
In this, Monica. Hey, Derek, thanks for your update. I appreciate it. I do want to shout out, or whatever we're doing today, Happy Face, whatever it is, to the website that you mentioned. I oftentimes in the course of my regular job get questions about how do we even do this? What are the rules? And man, your reorg has made that so much easier. It really has. I think it also takes a step towards maybe clearing up some misunderstandings that people have regarding the process or the complexity of the process. It should be a very intense process, right? We're taking care of people's babies and we want to make sure that's the safest spot. But just sometimes that visual layout can really make a difference. So thanks for that. I mean, it really has helped me as I've guided folks through the conversation of where do I even start? And, I used to say, call your local surveyor, but that oftentimes wasn't the most effective. So thanks, which leads to my second point. As somebody who was a licensed provider for 16 or so years, just seemed like 36. I cannot tell you the importance of continuous conversations with local surveyors. The intent of the regulations versus local interpretation can sometimes be frustrating and very natural. So thanks for recognizing that needs constant love and attention and watering.
Yeah, absolutely. Thank you, Monica. Just a little Well, I guess, yeah, first things first, the childcare licensing team and the communications team on the website did a wonderful job. And we're looking to expand on that even more. So a little teaser, I guess, we're looking to make some, I really want the webpage to be a little bit more inviting. You know, it's childcare licensing, it's fun, it's kiddos, right? It's very serious, but we want it to be welcoming. We want it to be warm. So we're working on some graphics for folks when they first kind of log on to that. Go to the homepage for childcare licensing to, you know, welcome to the childcare licensing webpage. Little small things like that. We're also working on a map tool so that folks, when they're trying to find their surveyor or trying to find information, my hope, again, this is not confirmed, working with IT and the GIS team, but my hope, they should simply be able to type in their address or the provider's address, however that may need to work, it will automatically pull the surveyor's info from whichever county or section of counties they are trying to get information on. So we're trying to make a lot more, make it more user-friendly and more modernized. So appreciate the feedback, and I'm going to pass that on for sure.
All right, very good. Thanks, Derek. Tanya.
She's not with
Yeah.
us.
Okay.
And I don't see anyone from DCF. So
Okay,
apologies for not cleaning up the slide.
that's all right. Carla, are you available? From Board of Regents. I'm not seeing her on my list.
No, I don't see her either.
I see Justice Wall. I thought he was going to be in a meeting, but he appears to be here. Justice Wall.
Yeah, no, I'm here. I'll be in a meeting later in June for the special
okay.
meeting.
I'm
So,
sorry. All right.
yeah, no problem. I'm Justice Keenan Wall from the Kansas Supreme Court, and just a couple things for the judicial branch update. First, some of you may already know, but next April in 2024, we will host an inaugural Child Welfare Summit in Topeka. And that's a 3-branch collaborative effort. It's really modeled after the Mental Health Summit that we hosted in 2022. But obviously the goal is different. The goal of this summit is just to create lasting improvement in child welfare. And so the summit, like the Mental Health Summit did, will include teams of child welfare professionals together from all Kansas judicial districts. And in addition to that, the planning committee for the summit will be comprised of people with experience in the child welfare system, other child welfare professionals, and all 3 branches of government. So it is really a collaborative effort. In fact, I think the planning meeting for the summit begins today as well. And Justice Standridge is doing a lot of work to push that forward. So we'll have further updates as we get more information and details regarding that summit. Second, just wanted to let everybody know that our Rural Justice Initiative is up and running. We've got a great group of folks that are fully invested in the work of this committee. We've had great support from other agencies and great media coverage. Everybody understands there's a real problem. And I think one of the issues that we're going to have work to do on is just where can we get our arms around what can we tackle, what can we not tackle to really be effective and make some lasting improvement regarding this issue. And we're also taking the show on the road. We're taking our next meeting to Great Bend to gather community feedback and let folks know that we're not just sitting here in Topeka talking about rural justice. We need to get feedback and input from those that are living in rural Kansas and understand the issues firsthand. So everybody's always welcome to attend these meetings. If you have information you want to share or you think there are opportunities to collaborate, please let me know because we have a lot of those offers already, and we're following up on it through our subcommittees. And we're really excited about the impact that we can make on this initiative. And I hear I've mentioned this before, but we talk about some of the very same issues that the cabinet programs are addressing in terms of childcare availability in these communities, housing, staffing shortages. And again, part of the issue will be for our committee defining what how broad of a scope are we going to take in terms of recommending policy changes and implementing programs and solutions. So those are really the two primary updates that I wanted to share, and I'll take any questions if there are any.
Okay. Any questions? I really appreciate the engagement of the judicial branch on these important issues, because it often comes down to you guys and gals. So appreciate what you're attempting to do. Glad you could be with us. Any other questions?
Just
All
as well,
right.
this is Melissa. I would just invite the team doing the planning, if there's anything that we can provide to support the goals of the gathering, let us know, whether it's sharing some of the information you've seen or helping shine light on any of the programs that are available that we're involved in. We are willing to provide information.
Thank you. I appreciate that. And I know Marilyn Harp is on our committee, and I know she's mentioned that as well. So we'll definitely follow up on that. And I appreciate that offer.
All right. Matthew, Department of Corrections.
All right. Good morning, everyone. Wanted to provide some updates that we're working on with the legislative session behind us now. We're working on some major changes that came out of that session. And some of those bigger ones has to do with our evidence-based practice fund that we grant out to various groups. And what that legislation did this year was really kind of open up some access to that grant funding through the evidence-based program account. This original account was created when we reduced the amount of out-of-home placements for youth. And then the savings that we use for that is designated towards community programs for justice-involved youth. The more recent changes provides the ability to provide assistance and programming to not just the youth, but also the families of that youth. So we're working on how does that work? How does that implementation process work? But it also extends that on not just justice-involved youth anymore, but also they use the phrase children exhibiting behavior that could lead to criminal charges. So some more early intervention going on there. We're working with DCF on an assessment that will help assess youth in that situation to see their level and need of care. It also opened up who's eligible to administer those programs. So might be touch maybe some of your agencies, maybe not. But traditionally it was focused on county agencies, or maybe it was funneled through a county advisory board. But now it is available directly to providers, as well as county mental health agencies, centers, community health centers, youth advocacy programs, and some others as well. So some more direct funding to some of those programs in the community. And within that, also, there's been a lot of interest and discussion around juvenile crisis centers. So these are kind of the general idea being that a place where youth can go where their behavior is disruptive and maybe, the home environment is not positive for either. But yet also it's not to the level of criminal care, and there's been or criminal behavior. And there's been a lot of discussion around, how do we address these issues? So we're trying to some legislation, and we're working with people to see what we can do to open up these juvenile crisis centers. There's none existing yet. But Johnson County, Sedgwick County are kind of the lead counties that are in those discussions right now. Some others that may not be directly related to this group, but also some interesting stuff going on. We're working with the Council of State Governments and a Stepping Up program. This has been a proven strategy in Kansas on the adult side, trying to avoid incarceration as well as increase the connection to behavioral health services. So we're working with CSCG to try to examine a youth model of this and introduce that in possibly Kansas being one of the first states to bring this on. So where we have the evidence-based practices on the adult side, how do we implement that on the youth side? So excited to get that going. Still in some early discussions on that one. We also will hopefully be implementing this year more of a family engagement program. It's something we've been working on for a while now. And this is really a program that's designed to engage the families of youth that are on supervision. So we found that through evidence-based practices that engaging the parents and the families of the youth kind of help that more positive outcome, and as well as kind of help reduce the probability and risk of younger siblings coming into the justice system. So again, looking at a lot of more prevention. And actually, we were working with people at OJA on that Child Welfare Summit next year to maybe try to get a program there. Last, probably one of the biggest positive highlights coming up, June 16th, our Kansas Juvenile Correctional Complex will be hosting their high school graduation for the youth at that facility. It's a great experience for those residents at the facility that recognizes their efforts, that they're trying to better themselves, and we can recognize their accomplishments. It's at times where family and friends get to come inside the facility and witness that graduation ceremony and share that experience. I've been to them a few times, and it's really great. They really kind of create a ceremony that is very similar to a high school in the community. So try to mirror that as much as they can. And it really gives those kids a positive impact. It's a day where very few times so many of them come into one room at once. We tend to try to keep some groups separated for various reasons, but I've talked to them before, and that's really the day when all of that goes to the side and they have a really great experience. So that's June 16th. At our correctional complex. It is open to the public, but you do kind of have to get on the list before you go. If anybody's interested, feel free to reach out to me and I can help that. But something we really look forward to every year. And that's all I have today, but I'm more than welcome to take any questions or.
Matt, remind us where that facility is located.
Yeah, it's in Topeka. Off like K24 and Topeka Avenue.
Thank you.
Boulevard.
Hey, Matt, this is Monica. I am really interested in what you said about the youth version of Stepping Up. As in my real job, I work with a lot of community mental health centers who are currently accessing SAMHSA dollars for certified community behavioral health centers, and are oftentimes looking for programs and projects that help them pull their goals and objectives together. And it sounds like this could be a lovely collision of a lot of good intent. So if there's any way that I could help or be part of making any connections, I'd love to do that. It sounds like a great idea.
Yeah, that's great. We're actually just kind of starting to get together kind of our own little advisory board. So I'm assuming I can pull your email from some of the other emails, and I'll send you at least kind of our one pager for now.
Thank you.
Of course.
Anything else for Matt? All right. Well, thank you all for those good reports. They're always interesting and amazing, all the good work being done. Melissa, you need to update us.
Okay. Thank you, everyone, for all of the many different projects in action and rolling out and helping improve the navigation of our early childhood system. It is my pleasure to be reporting to you today with a fully approved budget. This year, at the last several years, our budget has gone through the legislative process in two parts because of the technical nature of part of it being tied with the Department of Education and being in the education budget, and the rest of it being in the baseline budget for the states. So I'm pleased to tell you everything was approved and we are good to go with our CIF activities continuing as of July 1. I wanted to take a few minutes to report to you about the governor's early childhood transition task force. The task force has now held 2 meetings. The first meeting was at the end of March, and it was a chance for the 4 key state agencies to bring reports to the task force about the landscape of programs that are administered within each of the 4 agencies. So that is DCF, KDHE, KSDE, and the Children's Cabinet, being the 4 core agencies involved. Then we held a meeting on May 16th of the task force, and the Hunt Institute is the coordinator and convener. They invited representatives from the state of Colorado and the state of Missouri to come report to us about their efforts in their own states to create a single state agency dedicated to early childhood programs. And so they talked about the different approaches the 2 states took, and the successes they've seen to date, as well as challenges, i.e. things they wish they had known earlier, that they lessons learned that they were very happy to share with us. And moving forward, the next big thing is that the week of June 26th, the task force will be holding public listening sessions in communities across the state. So I am not the keeper of that agenda, but we will certainly be a conduit for information through all of the cabinet communication resources, including our weekly updates. So we'll post it on our website, we'll amplify on social media, and we will share information about where across the state that you might be able to join in. Anyone is welcome from the public, and it will be a chance to discuss at the community level and hear from stakeholders, parents, provide whomever takes the time to join us. What we're wanting to hear is what your experiences are interacting with the services and all of the programs that make up what we call the early childhood system. So stay tuned for more information. I think the first actual sessions will take place on Tuesday, June 27th, and continue through Friday afternoon for a total of 9 locations. And after taking in the public feedback, there will be work done to actually begin outlining a draft of the report. The August 17th meeting that's scheduled is entitled a work session and review of stakeholder feedback. So it'll be a chance for the task force members to come together and have committee discussion and conversation about the path forward. And then a meeting tentatively scheduled for October 18th to review and refine a draft of the actual report, so that there is time, if there are any recommendations made that affect the structure of programs within the state budget, that there's time, as I mentioned during our budget conversation, there's time to make some adjustments. So that's where I say, I don't know what might be coming, but if there's a need to revisit our budget, we will, as a board, entertain any updates that might be necessary. And then the final meeting of the task force is tentatively scheduled for December 11th to adopt the final report for presentation to the governor. We will have our final meeting of the year the first Friday in December, so ahead of the final meeting of the task force. But I will keep this cabinet up to date as news warrants and occurs, so that we are all working with a shared understanding of the direction this task force is taking. I serve as a member. Each of the agencies has a seat on the task force, and then there are 4 lawmakers, and the rest of the makeup is members of the public. So it has been an interesting process to date, and I appreciate that we are taking a look at this kind of streamlining and alignment that's much needed in the system. The next big thing is setting up some awareness of what you can expect at the June 23rd special meeting that we're holding at 1 p.m. That is a meeting designed to address the awards for the Child Care Capacity Accelerator. As a reminder, this is a project fueled by federal pandemic relief funds from 2 different sources. So we were on the receiving end of a grant of $20 million from the what's known in Kansas as the SPARK funding. That is officially ARPA State Fiscal Recovery Fund dollars. Those were discretionary funds that each state received, and out of the allotment that Kansas received, $20 million was directed for us to manage as grants to expand access to childcare slots across the state. This is the first source of funding that has allowed us to fund construction and major renovation. That is a really big need, and it is a very difficult source of allowable use of funds to come by. So we were excited to receive that, and then equally excited that our partners at DCF made available $20 million to match with that from their child care development, ARPA, pandemic relief, discretionary dollar fund. So we will use the 20 million from DCF to match up construction dollars with the major startup capital coming from the CCDF funding, so that we can fund projects to build or conduct major renovation and get off the ground from an operations standpoint, hire and equip and train and mentor and do all of the things to be successful programs. What you see on screen is what we are currently dealing with. The RFP closed May 15th. There were some technical issues, so we gave an additional 24-hour period for anyone that had been attempting to submit to have the ability to complete their application, given that the issues were technical in nature and beyond their control. So we had 105 total completed applications submitted. You can see the breakdown on screen of who is the identified lead in terms of sector. So it ranges from some economic development organizations. In 2 cases, it is a business as a major employer. We have nonprofits, we have licensed childcare providers, we have school districts. So it is gratifying to see that range of project leads identified across the state. It was certainly with part of the criteria developed was to encourage this kind of community level problem solving, and we did not want to dictate to a community who the best lead might be. There are 25 that represent really strong community coalitions or collaborative submissions. Again, this is the kind of effort we were hoping to see. So it's gratifying that the development of the program made sense to people. But here's the thing. We are currently in the process of we have a slate of reviewers reviewing all of these submissions. It's exciting to see the number of completed applications, but the demand far outstrips our financial capacity to make grants. So there was a total of $117.8 million requested. You can see that it was broken out as we were reviewing and getting organized up front. We divided them out based on the type of request. So we have far more demand than we have dollars to give, but my hope is that once the dust settles, that we can continue to make the case for the kind of investment needed to expand capacity across the state. The value of the projects, while they're requesting 117.8 million, the total value of the projects based on the additional financial resources that they've identified to help meet the budget for the projects is $225.3 million worth of project expansion across the state. That breaks down to 146 proposed facilities that be expanded or built, and 8,870 new childcare slots across the full spectrum of submitted plans. We broke it out so that you could see that specifically that's 1,287 infant slots, that defined as children 0 to 12 months, and 2,167 toddler slots defined as children 12 months to 2.5 years. Additional slots would be for children older than 2.5. So, and it includes some programs have school age kids that are included. So it is exciting. It's also daunting to think that, you know, we're going to have to winnow down to a slate that we present to you that fits the budget that we have to give. So we will equip you with prep materials just as soon as we've completed the review process. As I said, we have independent reviewers that have a rubric to use to score the applications. Each application will receive 2 sets of eyes, and then we will have some meetings are set aside. We will include the Department of Commerce and our partner agencies. We want to make sure we are maintaining criteria related to the funding sources and that we are within compliance for those things. So we don't want to approve a grant using Child Care Development Block Grant funds for activities that would not be deemed allowable by that program. We also want to make sure that we know the Department of Commerce has a couple of economic development programs. We want to make sure that we are not duplicating effort, that we are working in a collaborative manner to enhance and uplift and really give every dollar in a logical, meaningful way. So we will bring you a slate that has been vetted and researched and represents, again, we want to make sure that we are helping communities in every region of the state and that we are making the most of the capacity we have. So I know that's a lot of detail, but I think it's really a unique opportunity to make a very big difference. So again, we have a special meeting of this cabinet. The only agenda item for June 23rd will be consideration of the Child Care Capacity Accelerator Grant slate of recommendations. We will hold minutes from this meeting till our regular business in August. We will not add any other items to the agenda. We will solely focus on making these grant awards and making those decisions. I'll pause here because I want to give the cabinet time to process and ask any questions you might have before I move on to the final item in my update.
Anything?
It's Monica again. I'm sorry, I've had a lot to offer today, but I just want to say this is the last time I remember funding being available like this to childcare providers with the combination of the 2 components. I think it was like 1999, maybe 2000, but I'm not sure. Yep. And so as we look at the overall childcare crisis in Kansas, and as we have the current interest of a group of Kansas legislators, I really think we need to take the time and effort that locals who give a dang put forth to apply for these funds and see how we can collectively all work together, because this could be a monster
Mhm.
bite off of what is a monster problem that is not easily fixed, but could be a component. So these folks, I'm betting, work their tails off to get these applications in, because it was a great RFP process. I read it. So I'm excited that people cared, and I hope that we will be able as a group when we meet to make a significant bite in the funding, but maybe look to our other partners in the legislature to help us out a little bit.
I appreciate you making those observations. My hope is that when we have our slate completed, that I can provide information back to policymakers about the unfunded requests, because I think we'll see really high quality across the board, and it does speak to a significant need if we're going to meet the demand for childcare across the state. And I don't know, I have not seen the language at the federal level. I know part of the debt ceiling negotiated settlement includes clawing back some of the unspent pandemic relief funds. I'll note that we have an application into US Treasury as part of a separate American Rescue Plan bucket of money. It's known as the Capital Projects Fund, and again, it's federal dollars that would be allowed to be used for construction. And my hope had been that we could add another 40 million to meet the construction demands of this. I don't know if that clawback affects, like, we've had our application submitted since December of 2021. It has been the US Treasury side where it has been slow to process. They put their focus priority on processing broadband projects, and the capital projects are just now getting approved. So I don't know if those are protected from that clawback because they are in process or not. So that there was method to my hope that we could fund additional projects. That is beyond anything we control at the state level at this point. So we'll do our best to track whether there are any other sources that can be identified. But yeah, this is big, and the addition of the funds from DCF will help us with the question of staff for these new programs. We will be able to put effort into recruitment and training and mentoring and retention. So hopefully this will prove to be a meaningful change for Kansas families.
Yep, this is John Wilson. I would just, Monica and I went to the same thoughts, I think, once the dust settles on who we're able to fund, I think it'd be really important to kind of capture childcare slots left on the table or left unfunded. And given the, I think, record budget surplus that lawmakers will be managing in the upcoming session,
yep,
I think we can make a compelling case for this, because I was very appreciative of the bipartisan interest in childcare this last legislative session.
As was I, and I'll just note that the Children's Cabinet weighed in as a neutral conferee on the child care licensing bill. The legislature considered, with the specific requests, that there be an interim committee set up. I think lawmakers have also submitted that request, and we'll find out soon if Legislative Coordinating Council approves that. This would be crucial information for that, potential committee to know in a formal way. And if that doesn't come to be an interim committee that is approved, we certainly can make it a point of sharing the readout of the applications we received, the projects funded, and the demand left on the table that could be, you're right, John. I mean, this month alone, revenues for May were exceeded estimates once again. So there is room to make some decisions to help this important but struggling sector in the state.
Okay, anything else? Melissa, you said you had one more item?
Yep, I wanted to touch on the Dolly Parton Imagination Library. This is the updated map. We had another county become fully operational yesterday. So we're just excited to continue making progress towards turning the map green across the state. And we are actually, as a cabinet, we received the increase in our line item. So we have budget capacity to come in and help. We've got 2 local affiliates that are having some struggles. So we're going to help support them. And we're working to turn the map green to make sure that every family in the state has the access to the program that will give their kids the gift of books and love of reading. So by the numbers, we have 49,700 children currently enrolled, reflecting 26% of Kansas children under the age of 5. And we're down to just this tiny handful of counties left to be covered. One of the projects for the summer, Amanda mentioned Sunflower Summer. We are doing a tie-in with Sunflower Summer that involves 3 state park locations. It should be ready to unveil in early July, but we will have story adventures launching in July, which will be permanent installations. It'll be, each park will have a different story, and we're creating signage that will be installed, and it ties into the Sunflower Summer app where you can take your kids, and it's kind of an interactive walk through a storybook. And so we're really excited at the potential to provide something for families with very young children to also entertain and enrich their summertime experiences. So we will be sure to communicate more specific information about that. But that is a project that Imagination Library encourages, and so we're really excited about that feature being added on. And then there's room for us to add additional state park locations and new stories over time if that's warranted. We also, in the legislative process, succeeded in getting the legislative authority to create a 501c3 nonprofit entity that will be known as the Imagination Library of Kansas. That will allow us to take in donations and be a source of added support for sustaining the program. And so what that means is that I have a little bit of a legal project that will be engaging outside counsel to create articles of incorporation and bylaws for submission with our application for nonprofit status. I have received the benefit of the work the Dollywood Foundation does to support the program across the country. We are not the first state to do this by a long shot. So we've got templates that show us the way that will keep our legal expenses to a minimum, so that, you know, I'm not an attorney and don't want to pretend to be. So we definitely want appropriate legal eyes on the paperwork, but we're not going to have to pay someone to draft from scratch. And we have our advisory council that will be engaged in the work. We have a meeting of the Cabinet's Imagination Library Advisory Council at the end of next week. So we'll be diving into the decisions that need to be made about meeting cadence and membership and that sort of thing. But I'm excited. The 501c3 is going to become a reality. And then stay tuned. We have some exciting news to break for everyone about an event that's coming together that I think at this point, we're waiting for confirmation from a special guest, but we're looking at probable event in August to celebrate statewide expansion. So stay tuned on that front. And then I mentioned the need for a special meeting. So I think I'll stop there in terms of updates so that we can try and adjourn this meeting before 11.
Okay.
And create history.
All right.
So there's your meeting schedule. And again, 1 o'clock on June 23rd. We've booked 2 hours, but it's one item. We will present the slate. It is to protect time for robust committee discussion, but it's up to you all whether that amount of time is needed or not. I didn't want us to be limited to a 1 hour meeting and run out of time for a healthy discussion of the slate. So with that, Kim, I'll turn it back to you.
Okay. Well, any final questions or comments from anybody? If not, we'll accept a motion to adjourn, planning to meet on June 23rd at 1 o'clock again by Zoom. So is there a motion to adjourn?
So moved. This is Deanne.
Got a motion from Deanne.
This is John. I'll second.
Sean seconds. All in favor of adjourning, say aye.
Hi.
Aye.
Aye. Thank you all for another good meeting. We did beat we made the 11 o'clock deadline. We just did it. All right. Thank you all.
Bye.
Bye-bye.